chronic disease self-management support for persons with dementia in a clinical setting. Chronic disease is the leading cause of ill health in developed nations and causes 2/3 of all deaths worldwide. Patients with a comorbid dementia syndrome form a part of the chronic disease population in whom the burden of management is greater. These patients also have poorer outcomes. Adding to this complex situation is that the presence of dementia is frequently under-recognized. Effective therapy in chronic disease revolves around having a coordinated multidisciplinary care with patient self-management at the core. Contemporary care for persons with dementia involves an enabling approach, one that supports the well-being and for the affected person to remain involved in their care within the limits of cognitive impairment. From a cognitive perspective, self-management involves a dynamic and continuous process of self-regulation and adaptation to feedback. Hence, reduced cognitive functioning impacts successful management in chronic disease. It is important for clinicians to acknowledge that the impact of dementia on a patient's ability to self-manage will vary according to 1. The cognitive domain or domains affected, 2. The severity of the cognitive impairment, and finally, 3. Complexity of the self-care task required by the patient. In 2003, Lorigan Holman described the 5 key processes of disease self-management as problem identification and solution generation, decision-making, utilizing appropriate resources, working with clinicians, and finally, taking action. For a person with normal cognition, these processes allow for appropriate self-management. However, for people with cognitive impairment or dementia, these processes may be compromised. My co-authors and I sought to develop a framework to guide clinicians and allied health staff in a clinical setting to tailor management for such patients. We wanted to enable patients with chronic disease and dementia to self-manage. The framework is based on Lorigan Holman's 5 key self-management processes. We examined the impact of cognitive impairment on these 5 steps and how cognitively impaired individuals may present in a clinical setting. We also proposed solutions clinicians and other healthcare professionals may use to identify and respond to causes of non-adherence and other management issues. Chronic disease management for persons with cognitive impairment is complex, and patients with dementia may be vulnerable to poor outcomes. This is especially so if they are unable to negotiate self-management tasks. Good practice requires the clinician and other healthcare professionals to take responsibility for assessing the patient's current capabilities, identifying potential barriers to successful self-management, and to make efforts to implement self-management strategies tailored to the patient's set of abilities.